So hopefully everyone can see that poll. If you cannot, please let me know. And give you a few minutes to answer those. What are areas of need within your organization for addressing your essential employees' mental health? Please feel free to answer all of them. Give people a few minutes. And Jordan, whenever you're ready, you can close out the poll. Sometimes I feel like we need background music, like our Jeopardy music.
I could sing, Tracy, if you want.
I was just gonna say, you know, I have 2 kids in the house downstairs. I'm surprised I haven't heard Justin Bieber or Miranda Cosgrove being blared from the basement, so.
Age, because I don't even know who the second person was.
Right, 8. They're 8, and yeah, I definitely was dated when that one happened. Mental health awareness training, some very interesting results on the poll. PTO health and wellness days. I think those are, I'm going to actually take a picture of our poll. And then I'm going to get us started. Mental health awareness, I think 74%. I think these are really phenomenal feedback from the participants. So I'm going to kick it off with a question to Dr. Maine. What does mental health mean to your organization? Big question for you.
Well, you know, Tracy, I think I equate mental health with wellness. I mean, they're part and parcel, one in the same. If you're stressed, you may eat more. If you're depressed, you may eat less. It affects your family. It affects your work. We all spend more time at work than any place. And I think, unsurprisingly, the pandemic has triggered a wave of mental health issues, whether it's managing addiction, depression, social isolation, or just general stress that resulted from the pandemic, friends who've been afflicted by COVID-19, or the general situation. We're all feeling it. And I think one thing that is important to recognize is we're all feeling it, we're all in it, but we're all experiencing it differently. And we're all in different situations, and recognizing that, I think, is particularly important as we try to address mental health. And I think, you know, this is a bright spot of the pandemic because it's kind of magnified the issue of mental health and how it relates to wellness in the workforce across all sectors. You know, healthcare is generally, I would say, a stressful environment that was all the more compounded by the uncertainty of what's happening, fear for your job, fear for your family, fear for your friends, and this onslaught of information that was changing so rapidly, it became muddled, and it was very difficult for most people to sort it out. And so recognizing all of that and identifying a few key elements that could perhaps help some of those issues for our workforce, and I'm sure we'll get into some of this, we're absolutely critical for it, but just stepping back and recognizing that we're all in this, but we're all in it together, but we don't all experience the same way, I think is really important to try to ensure that your workforce is able to manage through this incredible kind of once in a lifetime crisis event that hopefully we can come out stronger from. So.
Yeah, I think your point is so valid, experiencing it differently, that we are all in it together, but the perspective and the optic is just different depending on what else is on your shoulders or what else you had coming into the pandemic. I wanted to open it up to Emily, Marty, or Molly to comment on that as well.
I'm happy to add on to that. I think, you know, like you mentioned, everyone brings different things and lived experiences with them, and we have to acknowledge that and acknowledge that the world we live in makes things way easier for some folks and more difficult than others because of systemic barriers and systemic racism and all of that. So for me, the importance of mental health in the workplace means that people have the ability to show up as who they are and to be able to bring that if they want or not, but that you can show up fully as yourself and be supported, especially, you know, in the food industry. That's not the norm. It's like, come, clock in, do your job, I don't care, margins are low, and leave. And for us, it's always been really important. And it's hard for other people to understand because we're like, it's okay if it takes you a little longer, and it's okay if you want to do it like this, and we'll find a way for you to get to work. But that's really important, that people know they can show up as their full selves and be heard if they want to be heard, and talk if they want to talk, and not just be like, put your head down, you're a machine, clock in and clock out. So, you know, recognizing that if you're trying to empower people and give people a voice, they're gonna talk, and it might be uncomfortable, and you have to like get comfortable being uncomfortable.
Uncomfortable conversations, really poignant part that has been brought to the attention throughout the past year. Marty, thoughts?
Yeah, one of the interesting things about mental health, particularly in construction is in the top 5 industries for suicide. And, you know, most people probably, you know, find that a little odd. And it is because when you think of construction, you think of, you know, burly guys, you know, they're pretty physical, but that's a problem. And that's why suicide's so high in construction, is because the persona of a construction worker is a tough, you know, man or woman, because there's certainly women in construction as well, and they hold their feelings in. So talking about mental health is extremely important, and specifically important to the construction industry. So, you know, as a company, we understand that, and we'll talk a little later about the types of things that we've done to try and help to pacify that issue.
Amazing that top 5 industries of suicide. Yeah. So because of all you have all been managing essential workers from different perspectives, whether it's construction or food service, individuals cleaning, from the beginning of the pandemic, how are you continuing to keep them mentally engaged and positive? We've passed the 1-year mark, right? And so I don't know if some people felt like magically 1 year would hit and there'd be a switch, but how are you managing to keep them engaged and positive? Because a year's a really long time.
A year's a really, really long time. And, you know, in our experience, you know, we went from, you know, being in like a pretty new business to start off with, and to experience, you know, the first month of it, we kind of shut down and only worked in places where there weren't people, and, you know, really were safeguarding our employees, to moving into the more, serious and extreme situations, you know, such as what we're doing with the Lord Baltimore Hotel, and the city and University of Maryland, where our staff is going in full PPE and working in an active COVID area, like where there are people that have COVID. And a lot of our staff are mothers and fathers and have families and things like that. So yes, I think we all tend, like, for us, getting vaccinated was a really great chance to like take a breath, but it really is giving us a chance to kind of slow down and kind of re-look at the processes that need to be put in place. So while we were going through that past year, it was all figuring it out as we go, making sure that we took care of people. I really liked what Emily said. It 100% is about meeting our staff's needs, kind of converting, or for our sense, like as we're building a culture as a new company, being as employee-centric as possible, you know, making sure that they can tell us what they need and then we can come and deliver it for them, and having those open communications, because I've always kind of viewed management and being a leader as, you know, my responsibility is to those that I lead, like making sure they're okay. No, we aren't breathing completely better. Like, no, like it's not just like perfect, but for us, we kind of got into a swing of like, you know, into the swing of things where we can actually start implementing the changes that are needed. So.
Thank you, Molly, for that. David?
Traci, I think,
Yeah.
I think you, when you said keeping folks mentally engaged and positive, and you mentioned that we're 1 year into it, and when that 1 year anniversary hit on the 11th, I sent a note out to the house, to all our employees, and you know, I kind of said, wow, this is a critical moment in our history. This is a moment that we're going to be talking, you know, generations to come will hear about this. There'll be books, just like on my bookshelf back here, there's a book about the flu pandemic from 18. There's going to be books about this, and what did we learn, and what do we want to hold on to, and what do we want to wash away, and trying to acknowledge the sacrifice and the fact that we all rose up and you've gotten this far, and just expressing gratitude. Just saying thank you is so meaningful. It's not always about dollars. It's not always about incentives. Sometimes just recognizing that you've gone above and beyond is so important, so valuable. And we've tried to do that through really regular and unique communication and rounding. It's different now. We're not having these big forums. They're much smaller. Some of them are virtual, but we try to do it in person when you can, and let them know, thank you. Wow, you've gone above. Things are changing. Is this a new normal? Maybe. And how about we try to embrace it and kind of stick to our mission and our focus. And you know, we've done some interesting things with free food to those who are managing on a COVID floor. We've given some incentive bonuses to those who are truly on the front line, who, you know, have worked endless hours and have sacrificed from their family, as well as many people on this panel, and I'm sure joining us have. And then you try to bring in some normalcy where you can, but it looks different now. And trying to say that's not the case is probably not healthy, because it is different. And we're probably, you know, better off embracing that and trying to bring some normalcy to what you can in a unique way. So you got to be a little bit more creative, but it's time well spent is my sense to this point. So. Yeah,
I like your comment, Dr. Maine, about the house, that you sent an email to the house, which really, that small word really shows that you're, you know, sort of all living under one roof, and that you're one big family, you know, with almost 5,000 employees. But it does make a very profound statement to me.
We are one family.
And I know that there are some unique attributes that you've done. I mean, just simple like Super Bowl battles between you and Sister Helen, and just some unique things that you've put out there to try and get people to feel normal. Like the world it's not normal, and it never will be again, but just to bring back some of those things that make us feel better.
Yeah, healthy distractions are kind of what we term that, and it was, you know, if you can do things that are whimsical for your workforce and distraction, make people smile, it is so worth it. That pays dividends in the wellness of your workforce, and can, you know, it doesn't cost very much to do so. Yeah.
Marty, any thoughts on what you've done for your team members?
Well, our company is really based and set up as a family-oriented company. You know, our CEO, Kevin Johnson, actually, several years ago, we talk about, you know, what is the mission, and we talk about customers. And, you know, we're set up where our employees are our customers. And in talking through that, the philosophy of that statement is that if we treat our employees really well, they're going to go out and do great things for the company, and therefore the ultimate end customer who we're building for is going to get the best product. So in doing that, our company, we have a life coach, and everybody has access to that person. She does not work in construction. She actually works with Ayana Van Zant. So she's a real life coach. We built a company gym, and everyone that works here has 24/7 access to the gym to be able to go work their stresses off. So there's just a lot of things that we do here that may be slightly different than other construction companies, at least. I'm actually a chef, so I routinely do special cooking engagements for the company, which is another kind of thing that we do to try to keep things light. So again, as a company, I think we do a lot to try and keep things, upbeat and keep folks happy at work.
Food is comfort, right? Right, Emma?
Yes, it is.
Food is comfort. Well, we all know communication is also very critical and to a healthy workforce. So what is different about your communication to your employees now versus prior to the pandemic? What do you think is shifting?
So for me, it's the timing. Because of the pandemic, we're communicating probably twice as much as we did before. Because before you'd have the casual kind of conversations of passing in the hall and being able to do a quick catch up. Now it's pretty much Zoom formal kind of communications. So we have most of our staff, the project management staff, is working from home, and they come in the office occasionally. Of course, you can't build a building from home, so all of the field staff is working on site. But again, it's not fair for them to have to work every day if the office folks are at home. So we actually work out where we rotate that as well out in the field to give those guys a break as well.
Smart. Anyone else want to talk about how communication has shifted?
I try to start most of my conversations with like a life check with like my staff whenever I talk to them. There are a lot of days where, they might not have said anything about a million different things that they were struggling with and could affect their work and things like that. And just being like, hey, are you okay? Before going into anything else that I need to talk to them, like it clears their mind and it like gives them the ability to come back to focus to work, or for me to evaluate if they really are in the right place to be working that day. Because that's, a call that has to be made almost daily, and it has been during these time. Because keeping up quality is also part of our business. And if someone's not in the right place or experience an emergency, things are rushed or things like that, like it could affect our business. But in doing so, our relationships and our culture is also formed like a very caring place where I mentioned earlier, like I'm recovering from my own health issue that took time away from work and needed extra coverage from my staff and things like that. And they're just as much, they take care of me too now, which is really nice.
Yeah, the how are you doing question. Dr. Maine?
First, I hope Marty invites us all over for dinner so we can taste his cooking, because I'm sure it's very good. But I think Marty hit it for us. It's about frequency. Knowledge is power, and particularly when things are changing quickly and there's uncertainty. Communicating frequently and creatively and being transparent. Certainly in healthcare was extremely important, and those are some things we still continue many of those issues, including sending out something to the house several times a week that highlights how many have been positive, how many are vaccinated, what our positivity rate is, how many COVID patients are in the hospital on the unit. and people can see it, ebb and flow, and can react to when things are improving, and stand tall when things are going the wrong direction. And it just being creative through things like that, as well as some community videos and encouragement to maintain positivity, being positive. That's not the right word to use, positivity, these days, but making sure folks remain positive in communication the best possible, but also not hiding the truth. Like when we were in that third wave, being honest that this is a real challenging time, and it's going to be difficult, and we're going to have to stand together to do that. And Marty mentioned the construction. The construction world doesn't stop. So we built a floor in a hospital that should take 6 to 9 months. They did it in 75 days, working around the clock, 24/7. And it was incredible what those workers did, and how strict they had to be in their own safety, but how we're able to communicate through all of that was critical. And so I think Marty kind of hit it. Frequency is important.
Yeah, Emily, you had brought up some points about your team and your communication with your family business.
Yeah, I can just kind of add on to what everyone said. I think like frequency and also transparency. I mean, we're not nearly as big of a business as the other folks on this panel, and don't have as many people, but it's still really important to, in the beginning of the pandemic, because the work for everyone was very uncertain, because we were working in food, right? And we were funded, we were getting money to make free meals based on a GoFundMe. And we're like, all right, great, we got $1,000, so we have enough for this week. We got $5,000 more, so we have enough for this week. 2 more weeks, 4 more weeks, whatever. And that was super hard for me, and I imagine much harder for folks on the other end who were living in this uncertainty. But to hopefully try and create a sense of solidarity, it's like, we're going to squeeze every penny out of this to keep as many people working as possible. And here's where we are. Here's where the reality is. So I think being honest and transparent, and then obviously, the frequency, and again, making sure people feel like they can ask the questions and express the concerns that they have, and that hopefully there'll be some sort of something that comes out of it. It just doesn't go into nowhere. So I think, and it's something we can always improve on still, is we can talk all day about all the things that we're doing and the efforts that we're taking, but what's hard and harder is to make sure that it's landing and that it's hitting people. We can say everything, but people really need to feel it. And that's where it gets challenging when you ask for feedback. That's the other thing, asking for feedback. Is this working? Do you feel good? And maybe sometimes the answer is no, or like looking at how things are going and saying like, things aren't really going well, and asking why. It's not just like someone else's fault. It's like, what are we doing that could be better?
We had a question in the chat. Have you seen an increase, and this is to anyone, in the number of employees actually struggling or suffering or reaching out for help during the pandemic? So did you start to see an increase of people expressing?
I would say it's a funding issue at the end of the day. I mean, we need to design policies that promote primary prevention of mental health. So, you have to promote primary prevention. You have to promote early identification and intervention for those at risk. You have to pay for it. Integrated care, treatment for those who need it, where they need it. And at the end of the day, the goal has to be recovery. That has to be the goal. And so, if those are the three, if those are the foundation, at least how I see it, you need funding, and that's a challenge. You hear that, highlighted here, but I do think the healthcare industry is kind of galvanized on this and really trying to move forward. But this is, the pandemic has highlighted the need, and hopefully you see progress.
Yeah, absolutely. For those that need help navigating that fine line between Medicaid enrollment and whether they're eligible on a qualified health plan and eligible for tax credits. I mean, that's what HCAM's navigators do in 6 jurisdictions. We are happy to support any essential worker or any, community resident in Maryland to help them just determine whether they're eligible for Medicaid or even what is the right plan to go into. And so our navigators are available. We'll make sure we get that contact information in the chat for you to call the call center for anybody that needs help. They've had continuous special open enrollments due to COVID. So many people lost their jobs due to COVID, and so they lost their health insurance. And so since March, they've had a special open enrollment period for individuals to be able to apply for benefits year round, where they couldn't only normally apply during November and December for qualified health plans. Medicaid is year round, of course. So I'm going to get us back to what is one tip or tactic that our audience should execute on when they get back to their workplace. So we saw the poll earlier. I'm going to remind you guys of the poll. I took a picture. There was 74% of our participants were interested in mental health awareness training, PTO, health and wellness days, 52%, rewards and employee recognition, 48%, and 37% were interested in counseling within your insurance network. So I'll walk away as we continue this conversation. It's a hard one to point out one.
I can't do one, but I'll suggest you got to be present. You got to be present for your employees, and ask the questions, frequent check-ins, and really, you can't do it virtually when people come back. You got to be present and check in and make sure your team is okay. And you know what? Some are going to be okay, and some are not. Some are going to have to slow walk it. Some may be better coming back to the workplace. It's not easy for everyone to be at home, but I think being present, thank them for what got you here and what'll get you forward. I just think it's so valuable.
Thank you, Dr. Maine. It is, for us, doing check-ins, I think is important. Again, it goes to being present, but doing check-ins, having those conversations with your team members that you might not normally see in the break room, or you just walk around to their cubicle and ask them how they're doing, how their day is going. And, I've had my team member even say, how are you doing? Like, how are you doing? And the answer is not fine, because there is no fine, right? And so really kind of probing a little bit and asking those questions of, how can I help you? How can I help you with your work, with your day? What are areas where you need some support? Changing your work schedule, I know, was something that has come up in conversation where, maybe you need to be present for your kids online. So you need that 3 to 4 hour gap in the middle of the day. And so you work later. And we've had those conversations with staff.
I'm working on currently, because one of the, we're implementing a lot of the things that we learned on the fly right now, and we're working on those processes. But your poll made me think about it, and it's something that we were working on, of sending, like, our staff are they're not located in one place ever. They're all over the place. They're working I have staff that works, 24 hours a day, like, not personally, but there's always someone on at a different location, and tracking that. So sending out a survey that's basically geared towards, how are you? What do you need? What can we do better? How can we support you more? And how did we make this job work for you specifically? And really ask them, like, what do we do for you?
Asking them, it's important, getting that feedback. Marty?
I would add, you have to be observant, right? So, the folks that work for me, I worked with them before the pandemic, so I know what they do, how they do it, how they look, how they feel, and notice changes in people. And when you see changes in people, that should trigger you to think that, maybe there's something wrong, because again, opening up to people is hard to do. You said, people ask you how you doing and fine. No one's fine. I can tell you that every time someone's asked me, how am I doing? my response is I'm fine. And I'm really not, right? As you said, nobody's really fine. So you really have to be observant and paying attention to people's mannerisms and the way they conduct business to, when you see those changes, then you got to really kind of sit down and do a little deeper dive into trying to get them to open up a little bit more to you.
Mm-hmm. Emily or Molly, any tips or tactics, I guess? The hard part is, the vaccine's here, and we're trying to work on, vaccine hesitancy within our organization and really trying to provide some incentives. We can't mandate it. We won't mandate it. Around it, we before it was part of law, we gave administrative leave to get the vaccine during the day. They could take the day off after the vaccine, up to 2 days, without touching any of their PTO for having any signs or symptoms. And so there is vaccine hesitancy, but we're definitely trying to help get people out there and get vaccinated as they get into their group. And it looks like there's more appointments opening up and really trying to get the community to buy into the vaccine. So I think that's another piece of it. It certainly doesn't keep you 100% safe, of course, and we know that, but really getting people, I think doing little things for me is, going out and sitting outside and having dinner with a friend seems so basic, and encouraging team members to even do that and asking them, what are they doing that was their normal or their norm, or what is something that they miss that they can't do, and how are they replacing it with something, as the springtime, as the warm weather, obviously not today, but as the warm weather comes out, what are they doing? Those are important questions to figure out how people are taking care of themselves.
If anyone could figure out a way to, bottle or market the
Uh-oh. Technical rain difficulty for Molly for a second. You are paused, Molly. So we'll get back to you on that one. It happens.
Yeah, I'll just add, Tracy.
Okay.
Molly's frozen in. She was going to say something amazing, so I really want to know.
Am I
She's back? There
now?
she is. She's.
Oh, there you are.
Oh.
Yes.
So I don't know what you heard, but I was saying, can we find a way to bottle and explain the feeling of feeling protected by the vaccine and make a marketing campaign for it? Because that is a really frustrating thing that I'm handling with my staff, is just the fear, not really understanding it, all of those sort of things, and just been I can't explain to you, I was fully vaccinated and I took the deepest breath. And as someone, I'm high risk, and I just keep trying to explain that to people. But I was also one of the first people that were vaccinated for H1N1. It's just we don't remember that one as much but I remember I was pregnant working at Johns Hopkins, and everyone's like, why are you going to get vaccinated? And I was like, because that's the best way to protect myself. There's definitely two sides of the line, and it's finding a way to merge both of those.
Yeah. There's a lot of communication around vaccine hesitancy that we're working on, whether it's at the city level, the state level, from the hospital perspective, and really just trying to get that message out to different communities about, and I get it, I get why the hesitancy is there. One last question, and I want to open it up to make sure that those in the audience can please put questions in either the Q&A or the chat. But our last question today is, what might be the future needs of essential workers? We talked a lot about what they needed during the pandemic. I know, Molly, you referenced PTSD, and I suspect that any time there's a new variant or someone comes down with some type of strange symptoms, we probably start to go in that pandemic mode again, or that fear mode. So thoughts about the essential worker. which really is so broad, right? And I'm glad we're keeping it broad. The grocery store, thank you to all the grocery stores that stayed open and gave us food, the Instacart driver who brought us food, the restaurants that went into takeout mode and really pivoted into how to feed even the healthcare workers, right? Lots of restaurants went into that space. So how can we support our essential workers in the future?
I think that, you know, Traci, you highlighted this idea of you know, people being afraid. COVID scared people away from the workforce in variety of sectors, and you know, I think something we need to continue doing for sure is this idea of recognition and value, making sure that we continually value our essential workers, because they are just that, essential. But also on the operation side, we need to increase training so that there's flexibility, allows greater flexibility in our workforce, and so that we can manage through these challenges. The lessons we've learned from this, you know, hopefully we don't forget them and take them with us. So I think there's something to be said for ensuring that your workforce has flexibility, and that you're training your workforce for that, and then appreciating them perhaps in a more deliberate and intentional manner than we may have done before.
Very fair statement.
I can add a few things. I think thinking about like kind of the essential sort of safety nets, right? And if you talk about grocery store workers and other people who are paid hourly, again, who might not have health insurance, childcare was a huge thing for us in the beginning, and we got a grant. You know, there were a few cooks who weren't going to be able to come because their kids were home from school, and there's no daycare, none of that. They're single mothers, and they're not eligible for any government benefits due to different statuses and whatnot. So we got a grant so we could just give them cash assistance. But like, that's kind of a social safety net that we need to have in place. So if they're essential, if like healthcare is uncertain, childcare is uncertain, transportation is uncertain, these are just basic minimum needs. And sometimes people are like, that's so cool that you guys are doing that. And it's like, well, it's a basic need. It's not innovative. It's not special. It's just allowing people to be able to show up. So I think thinking about how that is a priority, people shouldn't have to worry about that, in addition to all the other things that we could be nervous and scared and worry about. And again, $16 an hour, $15 an hour is not a ton of money for a single mother, for a mother with kids, whatever, or for anyone. So making sure those basic needs can be met without that being another thing that adds to your stress and drains on your mental health.
Yeah, and has to make that decision of choosing between staying home with a child and continuing to work. I know that our organization will continue to look at our essential workers. They were community health workers, social workers, nurses, who were helping people navigate not only healthcare, but social needs, those clients experiencing drug addiction, mental health, children in foster care, those pregnancy, those statuses don't change, and those experiences don't change. The opioid addiction continued to be an epidemic and continues to be in this country, and our team members were never stopped. Our team continued to work throughout the pandemic, and we delivered cribs to moms that didn't have cribs to keep them safe. And so a huge thank you to our team and Healthcare Access Maryland's team that continue to be essential during this pandemic. We do have a question in the Q&A. What rewards and recognition programs are you implementing in your businesses to help keep your essential employees engaged and positive?
We actually were trying to start doing it before the pandemic, but then it didn't really work because we were working on incentives and benefits that included back massage, like, because it's a very physical job. Cleaning all day is a very, very hard job. And, you know, there's different types and things like that, but we do a lot of like we do a lot of the real estate, and our real estate department is just blown up, and it's a lot of empty houses that need a lot of detail work. And I've filled in on several of them, so I know exactly how hard it is. And so providing like an incentive program where they can get a back massage or a manicure and a pedicure now that it's safer to go do these things, like actual physical, like something that is a self-care item, like task that they probably would never do for themselves, especially while everything's been so hard, and helping them get there. And so anything that would be kind of across that board. Yeah.
Yeah. Self-care is not going to the grocery store. Seen that one before, right? Or laundry. That's not self-care either. Dr. Maine, do you have an employee recognition program that you're working on?
I don't know. Laundry is kind of self. Well, you know, we've tried to be creative with this. I think we've taken a kind of two-pronged approach. This global approach. So how do you keep employees feeling good about where they work and bringing that goodness home? And we did something very simple. We gave out pies to everybody, and the goal was very simple. We wanted you to take it home and sit with your family and say, "Man, I love working at Mercy, and let's enjoy this with my family, my loved one, my friends, in a safe, whatever your bubble was, whatever was safe." And that really made a difference in terms of keeping people positive and valued for, you know, what they do. And then there's other little things that we've tried to do a little bit more focused. We have these you can probably see it, these little gift cards that we hand out, and I have a bunch of them in my office, but I could be walking, and if I see someone you know, maybe taking the extra mile with pushing someone in a wheelchair, or having a particularly kind smile to a patient or anyone, I can hand them this, and it covers their lunch for the day, and they just grab lunch at the cafeteria. And they're small tokens. We try to be targeted, and even some wage related incentives where you can. But I think you kind of have to keep evolving, and it just needs to be a priority for us. It happens at my table. We talk about this regularly, and even just talking about it, how do we keep our employees engaged and positive? You'll generate creative ideas, and you know, the pies was one of them. So you know,
food is comfort.
One way we've done it.
Yeah, we did a long weekend. I think it might have been Memorial Day weekend, if I recall correctly. We closed for the Friday before, just to say thank you to our team and give them an extra long weekend. I think it was Memorial Day weekend, but.
Well, you know, our look on it is we feel special just because we are essential. You know, the fact that you know, business for us didn't stop. So it was more normal than most. You know, the construction industry is used to PPE. You know, we have to work safe, whether it's COVID or whether it's I'm on the top of a 20-story building working off the side of it, you know. So all of those things that were required to keep us safe during COVID were just mutations of things that we already did. So, you know, we really felt blessed to be in a position where we could continue working. And, you know, the interesting thing for me is the construction industry as a whole came together. We had Zoom calls with every general contractor in this market. And we talked about the fact that, guys, we all have to make sure that we don't get shut down because, you know, we aren't operating safely as an industry. And I think the industry stepped up and made sure that we stayed open, because we could have been shut down like some other cities were.
Mm-hmm.
You know, construction did not continue in some other cities. They shut it down, and Maryland was able to stay operational.
I hope that collaboration continues, Marty.
It was special.
Yeah.
It really was.
And essential workers are important. They are the backbone of our infrastructure, of our city and state. And I want to thank everybody for joining us today. I want to thank our speakers, Dr. Maine, Molly Browning, Emily Lerman, and Marty Glaze, for their unique perspective on rethinking mental health, supporting Maryland's essential worker. Healthcare Access Maryland thanks our sponsors as well: Tribridge Partners, Kaiser Permanente, Tower Federal Credit Union, and Canton Cleaning Company for not only sponsoring, but joining our panel. Healthcare Access Maryland's mission is grounded in helping people apply for health insurance benefits, navigating those benefits. We know benefit coverage is not access, and so helping them navigate providers and understanding their benefits, and then addressing social needs to accessing care and improving their overall health and wellness. So we encourage you to follow us on all of our social media sites. Our next speaker series will be in May, and we'll be rethinking mental health for communities of color, and we hope that you can join us. We'll be sending out some information about that date, and it'll probably be the second week